Hello and welcome to today's webinar. Today we'll be talking about whole health innovation in a time of uncertainty, which is the name of our new project that we're happy to announce today. This is the kickoff webinar. My name is Derek Noland. I'm a community liaison with the Behavioral Health and Wellness Program at the School of Medicine on the University of Colorado's Anschutz Medical Campus. I've been in my role for about 4.5 years, and a lot of what I have done over that time is to help organizations to implement tobacco services and policies. So I'm very excited about this new project. We are changing directions a little bit this year in this project, and so this important kickoff webinar is designed to overview the project, provide some information about nicotine-free policies, and start to look at what our next steps will be. So that's what I've summarized here. In the past, and in some of our materials, first marketing this webinar, we did mention the Tobacco Innovative Grant name, which was the name of the project previously. But due to the changing landscape of nicotine-free policies in the world of tobacco and the impact of the COVID-19 pandemic, we are reframing to focus on whole health. And so that's really the reason for the new name. So once I overview what will be entailed in the project, I want to look at the evidence base and best practices for effective nicotine-free policies and provide you with some tools that you can use to get started or to reevaluate your current policies. And finally, we'll have a chance to introduce some upcoming training opportunities, and we will note that a questionnaire that will help us to gather information about where organizations currently stand. So let's overview the new project. So this is an initiative that ultimately is looking to create the most comprehensive nicotine-free policies possible. And we've recently updated our term. Often we use the term tobacco-free policies in the past, and we really are trying to shift that to nicotine-free policies now. And there's a lot of reasons for that, which we'll cover briefly in this webinar, but essentially we do need to account for the increasing presence of electronic nicotine devices, which may not have standard tobacco in them, and so the new term is a bit more comprehensive. We're very fortunate in that this project is in partnership with CDHC and in collaboration with the Colorado Department of Public Health and Environment, who provides oversight and funding for this project. And through this mechanism, we'll be able to provide an exclusive opportunity limited to CDHC member organizations. So this is an invitation-only webinar and project, and we're very pleased to have the support and the dedication of CDHC as we go forward. Ultimately, we are looking to develop a model nicotine-free policy for implementation across all of Colorado to make sure that Colorado remains a leader in this field. In terms of project rationale, there has been some shifts in emphasis for this type of work in recent months. This project is now aligned with the new CDC mandate to focus specifically on behavioral health populations and nicotine-free policy work. Essentially, the CDC is requiring that all state health departments do implement this focus. And so the timing for this revamping of our project really is perfect. Also, as I mentioned, there is a growing need to refine nicotine-free policies. Previously, BHWP, and I'll talk about our role in a moment, but previously we had worked with CDHC about 10 years ago to do a large environmental scan and to help with the implementation and refinement of policies. And so a lot of time has passed since we're more closely involved with your organizations, and we really do want to take the time to return, see where we're standing, see what we can do to help, and see what we can do to implement some of the changes that are needed to reflect the modern tobacco and nicotine landscape. So we'll be evaluating where Colorado agencies stand with respect to their current policies, again, via a brief questionnaire, and also, really importantly, through your input and feedback. We will have ample opportunities for you to participate and help drive this. Ultimately, we really want to set the table to support successful policy implementations into the years to come, really with a a goal to sustainability, to make policies as effective as possible so that we really can move the needle and support behavioral health populations with respect to tobacco use. And while I know that I'm preaching to the choir here, I know there's a lot of expertise around the impact of tobacco on behavioral health populations, so I'm not going to belabor this point, but I do just want to at least present just the start numbers that really drive this. So you see on the left here, we have the total number of deaths in the United States caused by tobacco, currently at 480,000. And on the right column, you can see numerous other common causes of death. And when we compare the two, all these causes combined don't even approach the number of deaths from tobacco. And I want to draw your attention to the dotted line on the left chart at the 200,000 mark. And that figure represents the burden specifically upon people with behavioral health conditions. And so I think we can clearly see that this relatively smaller portion of our society is representing a much greater burden of death, using cigarettes more frequently, representing a large part of the market. And some of the things that we know is that, if we treat people with behavioral health conditions in conjunction with tobacco treatment, we get better outcomes. We see less symptoms in their conditions, and less hospitalizations, less use of medicine. Medicine can be used in smaller doses. People are more likely to be able to quit other substances and sustain those quit attempts if they focus on tobacco as well. And ultimately, we're just promoting better treatment and recovery. So clearly, as you know, an important topic. Our nicotine-free philosophy for this project, I'll read this statement here. We're establishing nicotine-free policies and tobacco treatment services as essential components in offering healthcare services. So while we often hear about return on investment for policies and things of that nature, we really do want to highlight the fact that these really are part of offering ethical and comprehensive healthcare. It really would be a disservice to these populations if we did not address this really important piece of the equation. So our vision for creating nicotine-free policies is that ultimately we do want to produce an updated nicotine-free policy that can be used across Colorado, and we want to reflect a lot of the key recent developments in this field. I've noted the rise of ENDS products, clearly a major driver in this field and something that needs to be addressed in a comprehensive policy in order to account for the use of these products. Corresponding with that, we are seeing an increase in the presence of marijuana, and that is something that may be considered as well, particularly as that substance can be mixed in the solutions in the ENDS products. And more recently, unfortunately, the COVID-19 pandemic has changed the landscape, and a lot of telehealth services are becoming more important in that reality. And so we do want to take some time to look at those and consider how we might need to make allowances for that in policies as well. Our goal really is to keep Colorado a leader in the field. We've been doing this type of work for 20 years or longer, and we really want to position Colorado to stay in front here. So a little bit more about the Behavioral Health and Wellness Program. We have a lot of experience in this field of nicotine-free policies and tobacco-free policies previously. You can see on the right there, that's our Dimensions Tobacco-Free Policy Toolkit, which is a great tool that we've refined over the years. It's free for download, and it's been used by many, many organizations to help them get started and to refine their policies. And so while we do have this good product, we recognize that there's always a need to make refinements as things change, and so we'll be looking to do that. Our experience includes assisting hundreds of agencies all across the country to implement nicotine-free policies. And I want to point out, not only have we done this successfully in outpatient settings, but we've also been very successful in doing this and supporting them in inpatient and residential settings too. Sometimes these settings, may get a little more leeway, on the part of leadership or in policies. And so that really is a notion that we're trying to change. It really is a misnomer, and we can have effective results in those locations as well. And again, really alleviate the burden of tobacco on the populations that they serve. We do have previous experience working with CBHC, as I mentioned, so we're happy to, we've been in communication with them over the years, but we're happy to kind of reinvigorate that relationship and build it up a little bit more for this project. Likewise, we've been collaborating with SAMHSA over the years, and there'll be another valuable resource and support that we can pull in to further this project. So what else will BHWP be doing for this project? What will our role be? I mentioned that we will be administering and analyzing a questionnaire to see a snapshot of where CBHC member organizations currently stand with respect to their policies. Again, there'll be ample opportunity aside from that questionnaire for everyone to provide their input, their feedback, their thoughts about what's important for policies and concerns as well. We're also going to do an extensive review of existing nicotine-free policies from, reputable sources across the country, perhaps looking at the literature, conducting some key informant interviews, a lot of things like that to inform the project to make sure that we're doing this in a comprehensive manner. Another exciting portion of this that BHWP is able to offer is to provide some training opportunities to empower organizations to succeed. We do offer a couple of tobacco-specific trainings and some additional trainings that can be helpful in this arena as well, and I'll be reviewing those towards the end of the presentation. And really, again, our chief role and goal is to create and disseminate a model nicotine-free policy that really can be used across the state. And over the coming years, our intention is to assist organizations with the implementation of these policies and to support their sustainability for the long term. Okay, so that's a snapshot of the project. We will have time for questions at the end. But for now, I want to cover some of the basics for nicotine-free policy. So I'm going to review the best practices and our recommendations. And if you do take a look at our tobacco-free policy toolkit, you'll see that these closely align with that. A few notes at the beginning about nicotine-free policies in general. We'd like to point out just how many benefits there are. They do truly outweigh any sort of challenges. They really do pay off. Obviously, for our clients, we see better qualities of life. We do see, as I mentioned, less hospital admissions, less disease and death and disability, less people leaving against the advice of physicians. So really, it is a service that we owe it to our clients to provide if we're going to do the best possible healthcare. Likewise, it's beneficial for employees. And I'll point out, even for employees who are currently tobacco users, a lot of these people do want to quit, just as people with behavioral health conditions do. And sometimes they envision nicotine-free policies as the perfect time to really take that initiative and push forward in their quit attempt. Some other more practical or as practical benefits, we do see a better productivity. People potentially are healthier and less distracted, and that is supportive of better productivity, increased job satisfaction, less discrepancy between people taking smoke breaks or not, things of that nature, not being exposed to tobacco smoke for people who aren't users, things of that nature. We also see on the employee side, likewise, less hospital admissions and illnesses and things. We also see less absenteeism. People are mostly healthier and able to come to work more regularly, and less presenteeism, where people are physically at the office but distracted, perhaps dealing with withdrawal symptoms or going out for a smoke break or something of that nature. So again, while ROI, return on investment, is also something that we can get in a few years, we really like to frame all of these benefits as well. And of course, just the service that we're providing to our clients that we really owe them. We often use this slide to talk about individuals and how cues can lead to routines, and that behavior can lead to a reward. And so we also think about this model in terms of the organizational level too. It really is important to establish new patterns in order to implement change. Change is hard for organizations, but we can make it much easier and much more efficient. There tends to be a bias towards the status quo. People may fear loss of efficiency, spending time on the change, things of that nature. But some of the things that can support this and make change more enticing and smoother, having a clear rationale for the policy that's coming forward, having a very well thought out strategy for it, being able to adapt as things evolve and move forward. And we really do want to get people to a point where they desire and accept that change is coming, and hopefully support it as well. It's very important that we're aligning our nicotine-free policies with agency values. So we do want to take a look at the mission and core values of agencies. And clearly this is one of the ways in which we would be doing a disservice if we didn't address nicotine in this context. If our values are to provide the best healthcare possible to our clients, we really must include these policies and services to do that. It's likewise important to build a clear rationale for why we are doing this and present it to staff and clients as appropriate. Yes, we can point to return on investment, which essentially every agency will experience. It may take 3-4 years, but mark my words, when we look at the evidence, essentially every time we see return on investment. Communication of the policy, very important as well. We want to set our intentions clearly. We do want to communicate expectations as well, which will include the enforcement piece. We need to be clear about these things up front. And we absolutely do value the support of leadership. Direct communication of leadership and support for policies really is an important component in this work. So here are some guiding principles that I want to cover at the beginning for sustainable change. As I've mentioned, we really do want these policies to be sustainable for the long term, and using this framework and these principles will help to assure that. Consistency is a big one. I'm going to talk about that more than once during this presentation, but we need to be consistent in the way that we're implementing policies, enforcing policies, maintaining and evaluating our policies. We really do need to have that component. And we need to do these things in a competent way. It really needs to be well thought out and designed and clear, and a lot of things need to be considered in order to make this as effective as possible. Transparency is another huge one. We want to be clear about what we're doing and why we're doing it. We want to include a number of voices, as we'll see. And so we don't want this to be shrouded in secrecy. It's very important that everyone understands the changes that are coming or happening and the reason for them. Bidirectionality, we do want to hear from everyone involved. So in addition to the support of leadership and directors and CEOs, a bottom to top voice is important as well, if you will. So we really want that piece as well. And it's important to celebrate successes and recognize achievements in this process. And that's another thing that should be included in this. We're wanting our nicotine-free policy to not only be an effective policy that accomplishes what we're looking to do, but also something that we recognize that we're doing for our clients, and we want to celebrate that as well as milestones as we move through and achieve different accomplishments in our strategies and policies. So here is a link to our Dimensions Tobacco-Free Policy Toolkit. Again, we've used this to assist hundreds of individuals or agencies across the nation. And it is a great toolkit, but we're going to make it even stronger. And so I'll be pulling our 10 steps from this, and you can see those here. I'm not going to go through them explicitly in order, so I'll run them through in order now. The first step, and there can be some leeway here, but but in terms of order. But really the first step is to convene a wellness committee. We would then create a change plan. We could draft a policy and potentially redraft as needed as we're going through these processes. We need to communicate our plan to staff and clients, build community support. Important to consider our neighbors and other people and organizations that may be impacted by policies. We want to provide education to staff, particularly and clients. We do need to offer tobacco cessation services in order to supplement our policy and make it more practical and realistic. Ultimately, we launch our policy, perhaps with a practice launch date. Enforcement of the policy, once it is established in a clear and consistent way, and evaluation of the program. That's another huge component that we can't overlook, is to evaluate that periodically and make refinements. And so I'll be focusing on 9 of these today. For the build community support, it really is specific to that organization, but we do encourage organizations and agencies to consider where people may smoke, the impact on neighboring businesses, impact on perhaps other agencies that are connected in some way or another. So those measurements are important. We can even potentially include them in some of our communications and committee discussions, things like that. Okay, so let's look through at the 10 best practices. We'll begin with convening a wellness committee. So this is one of really 4 essential characteristics of effective, long-lasting nicotine-free policies. And we do see these reoccur in the literature. So the evidence base does present that having a wellness committee is very important. Having wellness champions is very important. And we do kind of go back and forth between the tobacco champions and wellness champions terms. Wellness champions really would be ideal for the policy perspective to show that this isn't just about tobacco, it's about promoting wellness overall. One of the third essential characteristics of an effective policy is to have a complete ban. Partial bans simply cause complications and challenges, and we really are more effective when we have complete bans. And I'll talk about that a little bit later. And we need a commitment to enforcement. We not that we're trying to punish people, but we do need to have clear guidelines for enforcement, and we do need to act upon enforcement. So that middle bullet point there, I do want to note, this is not a tobacco-free committee that we're forming. We really do want it to be more comprehensive in scope, even if it is, even if its primary objective or first priority might be a nicotine-free policy. It certainly could entail other things as well, and that can help with sustainability too. So the wellness committee composition, we really want to include all these different players in the field. So you can see not just our healthcare providers and our human resources staff and educators, but also a lot of these components that really help an agency run, including security and facilities management, different clients that really have a voice. Again, neighbors, important to include as well. And I really want to point out that we also need to include opponents. We need to hear from people who are opposed to the implementation of a policy, give them a voice, let them have their say, consider it, but ultimately encouraging people to have that say really will be helpful in smoothing over the transition into the policy. I also want to point out that the peer voice is an important part of this. As you probably know, peer providers are people who have lived experience and are providing services for people who are currently in those situations in which they may have been or have like conditions, behavioral health conditions. And so it's really important to include their voice. They can offer valuable perspective on how clients may react to nicotine-free policies, ways that we can implement them as smoothly as possible, even relaying some elements of the nicotine-free policies effectively to clients can be a useful mechanism there as well. Okay, so having established the wellness committee, we then would go to create a change plan, and 4 primary activities here. And you can certainly read a lot more about these in our tobacco-free toolkit. But we would construct a logic model, assess strengths and weaknesses, perhaps do a SWOT analysis, the strengths, weaknesses, opportunities, and threats, really deeply dive at, assess these closely. Build a timeline. We do want to know very clearly what we're working on here and with respect to time. We generally like to aim in the nearer term, perhaps 3 to 6 months for when the nicotine-free policy would be implemented. And ultimately, that timeline will result in the date at which the policy is going to be implemented. And once we determine and announce that, we want to stick with that date, absolutely. And identify human capital and budget so that we have practical components for creating the change plan and ultimately implementing it. And let's look at some other components that would potentially be part of this. The 5 A's, I'm sure many of you are familiar with this. Ask, advise, assess, assist, arrange. This is a great intervention for efficiently interacting with all clients. We do, of course, recommend that all clients are asked about tobacco use at every encounter. Should they be tobacco users, we encourage that they are advised to quit. And then depending on the agency, we can assess their tobacco dependence, assist them in a quit plan, things of that nature, and arrange for follow-up services. And you'll notice we have our medication logo in the center of the 5 A's ring, and that's because providing medication to treat withdrawal symptoms and make people comfortable in the context of a nicotine-free policy really is important. We cannot overlook that. As part of our service to these people, we do need to make it realistic for them to be able to come in and receive our services. But the gold standard really is to perform at least the ask advice for every patient every time. If we can integrate these processes into our workflow as carefully and thoughtfully as possible, we can certainly streamline our processes, make this much more efficient, make it so that it's not too much of a burden on our staffs. Okay, and we do, as I said, want to integrate medication and medication-assisted treatment into our policies. So this is a combination of behavioral interventions and medications to treat substance use disorders. So both offering all the 7 FDA-approved pharmacotherapy options for tobacco use, also different types of counseling services, whether it be individual counseling or group counseling, things of that nature. I also want to point out that this is a highly effective treatment option for individuals who have other types of dependence in addition to tobacco, perhaps alcohol, opioids, and others. And using this technique really does reduce illicit drug use and overdose deaths. And likewise, as I mentioned, we're helping people to avoid withdrawal and be comfortable coming to the agency and using our services. So it really is an important component. And as I noted earlier, it really can help people to sustain long-term quit attempts if we address all these things simultaneously, and if we provide best practices like medication and therapy so that we can get the highest possible cessation rates. I do want to draw your attention quickly to some of our other evidence-based guidance that we have also available for download on our website. We have a number of toolkits in addition to the tobacco-free policy toolkit. These mostly being aimed at healthcare providers of many varieties. But we have a lot of different supplements that focus on justice-involved populations, of course, behavioral health populations, some younger priority age groups, low-income groups, and even pregnant and postpartum considerations. So would encourage you to look at those, and those are things that we can use to support the work of this project as well. Okay, so we've covered creating the change plan now, and at this point we would potentially begin drafting our policy. I'm going to come back to that point in a moment and focus on communication first. So communication, again, starts from the beginning of the planning process. So these are things that are starting potentially as we're drafting our policy or even before. Communication carries on through the entire process, and really there is no end to communication. It's constant and it's thorough. And an important point, again, is that we really need to communicate leadership's commitment and backing for the policy. Having a very clear message on those grounds is important and really gives it strength and makes it more likely to succeed. As I've mentioned, we want to connect the policy to our core values and our mission, presumably to offer the best possible healthcare services to our clients and to behavioral health populations, and therefore we need to address nicotine as well via policy. Again, we want to elicit input and feedback, so we're proactively trying to engage people and get them to share their opinions. We do want to hear all voices as best we can. We also, another thing that needs to be communicated is the enforcement aspect. How will the policy be enforced? That needs to be clearly outlined so that people understand what to expect. And of course, it needs to be, once that determination is made, those policies do need to be followed as well. And yes, utilize multiple voices and perspectives in doing this. Okay, so some other things that we can be doing alongside drafting the policy. We do want to provide education. Education is an important component in this that from another number of perspectives, so that, again, so that people understand the reason why we're doing this policy change or implementation, but then also from a practical perspective, what education can we provide them to make sure that the nicotine-free policy is implemented and runs as smoothly as possible? And we've listed a number of things here. Letting people know about behavioral health and nicotine addiction, training them on the burden of disease and some of those complications that can occur if tobacco treatment is not addressed as well. Different pharmacotherapy and counseling options so that people know how to make medication recommendations, how to perform good counseling, things of that nature. And this is one of the places in which the Behavioral Health and Wellness Program can help via our training opportunities. Brief screening and assessment tools, training people on how to administer these things and implement them effectively so that, again, we're streamlining our processes and making the policy as smooth and efficient as possible. Education about treatment and discharge planning so that we have plans and know-how in place for that. We do want to understand the challenges that unique priority populations face. Not that we assume that everyone within a certain population is the same, but there are certain considerations that we can make that can help our engagement with them to be even more efficient. And we want to talk through how we can take advantage of community referrals, whether to other agencies if necessary for specific treatments. And of course, the Colorado Quit Line can be a really useful resource in this respect as well, as one example. We also want to offer staff cessation support and education. So really, recognizing that there will be people on staff who are tobacco users. We're in a good place, and much less so than in the past. But these individuals will have certain, are more likely to have certain dispositions toward the policy. Maybe they don't as quickly believe some of the evidence that we present. So we really do need to be clear in our training. We do need to highlight that evidence in a very clear manner, build the rationale, kind of dispel some of these misnomers, highlight the value of medication and how that's going to help us to implement the policy in a responsible and respectful way. And I also want to point out, while there, again, maybe some people opposed who are tobacco users, as I mentioned earlier, the silent majority of tobacco users very likely may be in favor of the policy, again, as kind of a springboard for them to try to take another quit attempt and hopefully sustain it. Okay, those two addressed. We look at draft the policy now. So again, the third point in order, but something that happens over a period of time. Policy absolutely needs to be comprehensive. We need to consider all the different types of employees who might be impacted, of course, in addition to clients, but volunteers, interns, everyone really needs to be explicitly included in the policy. Also, we need to cover all the different types of products, and again, that's one of the reasons why we're revamping our own policy and launching this project. We do need to think about some of the ramifications of the new products, the electronic nicotine devices that have entered this field. And the policy needs to be complete in that it covers all of our different locations, inside, outside, different divisions, all times of day. This is really important. We want to be consistent so that all the different locations within an agency are on the same page and there isn't confusion about one site having an element of a policy and one site not. So important piece here. And of course, we can use feedback that we get and communication from our wellness committee to help inform the policy. There's some model language there for electronic nicotine devices. Essentially, we know that the term tobacco-free may not cover everything in this field, and so we really do need to move to that nicotine-free policy statement. And addressing these devices is going to be really important going forward. That we do need to think about their impact and how we can, help people in this perspective as well. While it is better for adults with an established smoking habit to use these devices if they use them solely as opposed to tobacco products, we're still aiming for abstinence and trying to ultimately get people to be completely nicotine-free, which our policy will help to do. Okay, so having drafted the plan, having covered all these steps, it would be an appropriate time to launch the policy. And one way in which to launch a policy is to have a practice day, or even a couple of practice days, and that can be a really good way to start to identify challenges and to practice enforcement. Just a good way to get a sense of where things stand and to make any perhaps subtle tweaks in between the time of the practice day and the launch. We could certainly announce our practice day or even practice days in addition to the day that the launch will be, the full launch will occur as well. Again, communication is key. We want to have regular communication and reminders as we're going through. Let people know several times this is happening on this date. That is the nicotine-free policy implementation or refinement, and make it very clear, and people will appreciate that you're committed to this process and sticking with it. And it'd be great to frame the launch of the policy more as a celebration in terms of a positive aspect, something that we're doing to support the health of our clients and our staff, and celebrating simply the creation of the policy and the launch of the policy is great too. So with the policy launch in place, the final two components, enforcement and evaluation, come into play. So I want to say at the start that enforcement will not be as bad as you think, and it gets better over time. Sometimes it can get better pretty quickly. Again, there is a silent majority that is generally in support of these policies, and while we may hear a few outspoken people, usually when these policies go into place, people essentially abide by them. And again, if we're able to enforce policy in an efficient way, this will really strengthen it and really make this much less of an issue. So some strategies for enforcing policies. Some things that can be useful would be to develop scripts that people can read and understand for talking to people about the policy and enforcement aspects. We don't want it to be viewed as a negative, punitive type of approach. We'd really rather use a positive engagement approach, trying to spin this as a service, again, that we're doing for everyone's health. We can enlist outside support if necessary. Sometimes having a tangential third party can help alleviate some of the pressure on the agency and maybe even provide better coverage for enforcement. again, it's really important that we're consistent and we're continuous in the application of enforcement. We don't want to be seen as favoring some people over others or anything of that nature. So it really does need to be enforced consistently and fairly. And simply put, we must follow through on disciplinary action. If the policy states that someone will, face some sort of action for violating the policy, then unfortunately that does need to be implemented. Otherwise, we can undermine the policy and start to lose control. So again, not to frame enforcement as a major problem or anything to be overly concerned about, but it is something that we need to do in a conscientious and consistent, thorough manner. So I've talked about consistency a lot. It really is key. It is the single largest factor separating successful policy initiatives to unsuccessful ones. We need clear administrative processes for dealing with enforcement and clear support for the policies too. Some other notes on that, total bans. So implementing a complete nicotine-free policy ban versus a transitional one, or one that's phased at different locations, or maybe doesn't address everyone on staff or everyone that comes to the facility. Those sort of partial bans are less effective than a total ban. Total bans do produce better outcome. They do lead to more satisfaction with the policy. It's clearer, people know what to expect, they're comfortable with it. And ultimately, total bans do result in better benefits to patient health. And so it's really important that we use this approach and we devise a good policy and we trust it and we implement it fully. On the other side, just to give some voice to this, the downside of incremental change, again, best to go 100% nicotine free. We don't want to make investments in transitional phases. Really, it's more cost effective to do this as a whole. And policies that are inconsistent, where different people or sites might be exempt, does lead to perceptions of favoritism again, and really can start to question legitimacy of the policy. If one site is saying that it's really important for the health of the clients that we have this complete policy in place, and another doesn't currently have a policy in place, that really is a mixed message. And so another reason why we do have these complete bans, total bans, and why consistency is so important. Just a little bit on incremental change outcomes. We do see that we need to get departments aligned, staff aligned, so that everyone's on the same page. It will produce more favorable outcomes. We want to be consistent across departments and clinics, as I've mentioned. Otherwise, we do get that sense of inequity. And what we see with also another reason for in support of the total ban implementation is that we see a less aggression, less need for restraint and discharge against medical advice. All those things are going to be reduced. We're going to have better outcomes if we do that absolute ban. Okay, so that is the enforcement side of things, and an evaluation is a really important component too. This is something that really never ends and can be done periodically as both as the project is being implemented and as it unfolds over the years. It begins during the planning phase. We want to think through how we're going to evaluate this, how we'll know its success from the beginning. And we can conduct regular post-implementation evaluations in order to understand where we're at and to schedule these regularly. We can utilize plan, do, study, act cycles to enhance this project. I won't spend a lot of time here, but essentially it's a cyclical model that we can use for evaluating our policies, also called the Deming model, if you're interested in learning more. We really ask ourselves three key questions. What are we trying to accomplish? How will we know a change is in improvement? And what change can we make that will result in improvement? So we really are doing this in a very thoughtful, data-driven way. And we do need to take the time to study our findings and and be able to act and refine them to revise our plans and continue the process. So again, we do think of it as a cyclical cycle, and it's always helping to inform evaluation and strengthen that component. And SMART goals, I will pass over this quickly, but we really want our goals to be specific so that everyone knows what to expect. They do need to be measurable so that, again, with respect to the PDSA and evaluation, so that we know that they've been achieved. We want them to be attainable, so setting goals that we can reach and know that we can reach so that we do achieve them and not fall short. They need to be realistic and that we have the resources and tools to do it, and a time base is really important too. So setting a tight timeline and sticking to it on what we're looking to achieve. Okay, so that was the overview of nicotine-free policies. And now I want to look at next steps, returning to our project, again, our Whole Health Innovation in a Time of Uncertainty project. So what is coming next? We would like to onboard the CBHC member organizations into the project. I know that we have relationships with several of you, and off and on over the years, we've been involved in various projects. We really do want to firm up and establish those relationships, get to know you better, build context, and we really want to learn more about your needs and priorities. This project is designed to be helpful for all the different organizations and agencies, in addition to the people of Colorado. And our questionnaire will help as a baseline to assess the current standing, but again, we really will be providing a lot of opportunity for input and feedback. Another important piece, and I've mentioned this, is that we will be able to offer training opportunities for participating CBHC members. And I know you may be aware that we're giving priority to those organizations that are participating and take on the challenge and want to either implement or refine their nicotine-free policies. And another thing that we'll be doing, and this may be supported and supplemented by our trainings, but we do want to identify key contact points who can serve as tobacco champions. And I know I mentioned the wellness champions term earlier. This individual will be definitely focused primarily on the tobacco side of things, and in addition to wellness. But we are looking for people that are excited to take the lead, get the knowledge, extensive knowledge base needed, and to be contact points, and to help let us know what else is new and how things are going as the project unfolds over the months, years to come. So the training opportunities, I do want to highlight this one in particular. This is our the Behavioral Health and Wellness Program's Rocky Mountain Tobacco Treatment Specialist Training Program. So this training is a 4-day training that teaches people everything they need to know about tobacco and working with clients individually. And so ultimately it does create people who can be empowered tobacco champions for their organizations. And importantly, this does also enable people to perform billable tobacco counseling services. We know that with respect to sustainability and making this realistic, that we need to find mechanisms for getting compensation for our time. So an important acknowledgement, and one that we support through this opportunity. Yet again, participating organizations will receive priority consideration for these training spots, and we will have an amount that we can offer as years go on, depending on how the project evolves. We may also have some additional training opportunities too. One of them specific to tobacco being our Dimensions Tobacco-Free program, Advanced Techniques. This is a 6-session tobacco-free group curriculum, each session containing multiple activities. And so this is an evidence-based program that we launched getting close to 20 years ago now, maybe 15. And it really is used all across the country, probably about half the states. And it's a really effective tool that we may be able to offer as well. And likewise, it is a billable tobacco counseling service, also with respect to sustainability and generating income for this work. Potentially some other trainings. We have the Dimensions Well Body program, which really goes above and beyond tobacco and looks at overall wellness, including looking at nutrition and sleep and stress management and physical activity. Those key components, in addition to tobacco, can really help a person with behavior change and to quit tobacco. And speaking of behavior change, we also have our Dimensions Motivational Interviewing for Behavior Change. That's a level 1 and a level 2 training. And that training really teaches people the technique of motivational interviewing, which is a communication style that can help to elicit that client's strengths and resources and really get them inspired and motivated to pursue a behavior change of their choosing. It really does rely on that individual with guidance and support from the counselor. Okay, and so I've mentioned this throughout, but we do want your input as time goes on. So BHWP does encourage all our CBHC member organizations to become involved in the model policy development. We want this policy to be as useful and effective as possible, and we know that to accomplish those goals, we do need your input. So we'll be providing those opportunities as we go. So we can think about components to include in nicotine-free policies. We can look at challenges that you may experience related to the policies or challenges that you may perceive as well to target them from the beginning. And we want to be able to offer practical and useful support. And so we'll be able to do things such as webinars of this nature going forward, obviously, producing and disseminating the policy, of course, and supporting your efforts to implement that. Okay, and we have about 5 minutes left, so I'm going to return to the room and ask if you have any initial thoughts or comments or questions. So. And we can unmute anyone who would want to talk. There's also a chat feature that we can use if anyone wants to talk. Any questions? Well, I'll give it just a moment, but I do want to thank everyone for being present today. I hope that this has been inspiring, and perhaps we have some tobacco champion candidates in the room. We do have a question from Casey. What are the next steps for organizations that want to be involved? You can expect to receive periodic correspondence from us and primarily through CBHC as the project evolves. We will start ramping up. We'll be, as I mentioned, administering a brief questionnaire that some CEOs and clinical directors will be able to complete to get things going forward. And also a question about making the slides available. Yes, we can look into that. We could provide them in a PDF format, perhaps. So thank you for those questions. And we are still evaluating the best way to go forward with next steps. So that can even be something that we would value your insights on as well. And any final questions before we wrap up for the day? And if anyone wants to ask their question aloud, we can unmute you and hear from you. Or if anyone's just excited and wants to share that with the crowd. Okay, well, I'll wrap up. Again, my name's Derek Noland. I'm a community liaison at the Behavioral Health and Wellness Program. You'll be hearing from me over time. Our director, Dr. Chad Morris, is also on the line, and he'll also be closely involved in this project. So you'll have BHWP support.